Hi.
Do you have enough employees in the state to handle these renewals? I know that DHS is about running right now with about 120 vacancies.
So it's definitely an area of concern. We do feel as though we have the staff, we have ongoing efforts with recruitment and retention in process. We have in our 60-day staffing report, we report that's the last number. It was 117 across the entire agency. That's not specific to just the DHS operations team. So when we break that number down, which I don't actually have in front of me right now, but happy to give the more specifics. When we break that number down, there is around 75 positions that affect the field operations team. We do have all of those covered in terms of in process for being different stages of the recruitment process. We have offers being made to at least 15 to 20 from last week to this week. I cannot say that that number will be zero when we get into the end of April or May, but I do feel that our workforce projection, the work that we put into that model does allocate the staff that we need to manage the work ahead that we know through the renewal process and then anticipated new work coming in. Doesn't mean it'll be easy, and it does mean we will need additional support in terms of our interagency work and community providers and such.
Hoping that nobody falls through the cracks.
Absolutely, yes.
Representative Tanzi, if we could keep it, the reps were gracious enough to have us here before this session, and we'd be happy to answer any more questions after the fact. Thank you so much.
So the slides aren't actually numbered, but it's the
Oh.
automatic enrollment premium supports.
Yes.
slide.
Yep.
So it talks about how they'll be automatically enrolled. What if they don't open up their mail? What if they don't respond? So I just want to make it clear that people, this auto-enroll is only if you're declined. Is that right?
I can speak to that. So you're automatically enrolled if you're somebody who has lost Medicaid coverage and then you fit within those income brackets I described. You'll have a notice that goes out to explain to you exactly what has happened. You'll also receive information once you're actually enrolled in the plan to confirm that you're enrolled. And then while you won't have a premium in the first 2 months, you'll still receive an invoice that will also include some language explaining why you're getting the invoice, that you've been automatically enrolled, and directing you as to where to get more information.
Even if they didn't open up their mail, they didn't respond in any way, shape, or form, they're not on Medicaid, we're assuming that they're going to be at the 200% FPL, or probably.
We were able to take that information because we have a shared system. Once somebody comes off of Medicaid, we run their eligibility and we're able to see where they fall on the income spectrum. That's also one of the reasons we're really encouraging people to update their information. And then I think you were also sort of poking at what if they don't open up their mail. Generally speaking, Health Source or I uses a number of different channels to reach people that go above and beyond snail mail or US mail. We use email, we use text messaging, and at times we're also able to use outbound phone calls.
Okay, then I'm going to ask one more and then turn it over quickly. Notice number 4 is reminder we still need information we have not received. Will it be specific as to what's missing? Let's say we need income verification, or we need you to tell us, or it's just going to say you're missing information.
It lists what information
Yes.
they're requesting they provide.
Yes, yes.
Right, give me an idea of how many renewals going to go out April, May, and June, and will the call center be open again on Wednesdays?
I don't have the numbers. I wonder if
I
you
know.
have the list. I want to say for
It's
April
13,000.
is about 13,000. For May, it's slightly higher than that. The numbers are lower the first 3 months, so we can determine how things are going to go. So between 13,000 and 20,000, I want to say. We can get you the exact numbers. And then, I'm sorry, your second question?
Call center will be open on Wednesdays.
So I'll let Director Brito answer
Sure.
that.
So we implemented a pilot, our Processing Wednesdays, we call that, and we have reverted on Wednesdays that technology platform options are available for customers. So the staff are diverted to work back office tasks. I'm giving a little bit of that background before then answering the question, because what we have found is diverting diverting our callers to use our IVR 24/7 or any of the other technology platforms allows the staff to focus on back office. We've been able to see our backlog come down and keep up on the processing. We expect that the paper coming to us in the next 12 months is going to exceed even higher than what we're receiving now. So it's something we tried a couple of months in advance to get our customer base used to that. So we don't expect changing that unless it warrants that we need to if something happens. Of course, we're going to shift and pivot if we need to. The answer is that the teams will still be working the back office, and that, yes.
Just quickly, I just want to, 13,600 in May, 14,200 in June, and 14,600 in July. So those are the next 3 months.
Two questions. On your distribution, all the various groups, is there a way, if you log in, can you find out which group you're in so you can plan accordingly?
Yes,
Okay,
so,
so that's helpful.
Yes.
Very helpful.
Yes.
And if you are a active renewal,
Yes.
do you use a caseworker system where I send my stuff in and one person is responsible for it and I know I can go to that person if I have questions and I know I'm going to be working with that same caseworker and I know who they are and I have their phone number and I can email them? Or is it a team effort? Like, how do you
Sure.
process?
Sure. We moved away from caseloads back in 2016. So one area that still has a little bit of a caseload is our long-term services and supports teams. They work a little bit more with the family from beginning to end. Otherwise, our eligibility processing is more on a task-based system. So teams pick up tasks and work those. So verifications as they come in, we have eligibility staff that are picking up those verifications, working them, making outbound calls if they need to and such. We do have one centralized phone number. That doesn't mean that the staff, for programs that have interview requirements, we do outbound calls. That's happening from the staff's desk, but we have one centralized line to come in.
Thank you.
A couple questions on the groupings as well. Have you prioritized particular populations for the first cohort, the second cohort? Thinking of long-term care eligibility, those are the most complex cases where they fall on the spectrum.
yeah, so the way in which it was laid out for the 12 months, with the exception of children and families with children, is a portion of each of the various populations. So it's broken up into our MAGI population, our complex LTSS population, where there is overlap with other programs and we have information, we utilize that as well. So it's a mix of each population to try to minimize confusion and keep caseloads in check and just manage the expectation and the work that are surrounding the different populations.
Again, we have Rep. Serpa and then Rep. Stewart
I wasn't finished, I'm just going to ask more questions.
and then Rep. Jello.
I wanted to just follow up on the communication strategy for our community, for us as reps. This is great information. What other resources could we use to push out to our communities, push out to community partners? Is there tools for us?
Yes, so on the website, if you go to the website, staycoveredri.gov, there are posters that can be printed, pamphlets, brochures that can be put in the front offices. All the information is there and printable and available to anyone who would like to utilize it.
With respect to the auto-enrollment proposal, there's a one-pager that was handed out today, too, and you can follow up with any questions.
Hi, Rep. Soper.
Just a quick question. It's hard to hear the questions down here. It's hard to summary and repeat. I'm just wondering, I realize that the letters just went out and going to begin the process on April 1st. But I'm just wondering, if you call like a small practice population to anticipate or not, the larger problems that may or not come. I just want to do like a practice run, trial run.
So we didn't necessarily do a formal trial run, but in the fall, this past fall, we had an open enrollment period for Medicaid where we were able to understand what our return mail rate was, who we were reaching, who we weren't, and we worked with our partners at the MCOs to try to get more updated address information, et cetera. So indirectly, we did that, but not a formal mini test.
Hi. Under what conditions might someone experience a gap in coverage?
A gap in coverage could occur if they have yet to submit paperwork in the time frame that it's necessary. So the requirements are that we send the notice, that we then send another notice, a reminder notice, and that we use 2 other modalities, what they call modalities, to try to reach the member prior to a termination. So that could be text messaging, it could be a phone call, it could be a visit. After that, if we still are unable, then the action for termination would begin.
We had a, yep.
Hi.
Thank you. I am curious, as I've been for months, what's the current hold time for on your call centers?
Our average, as of this week, I think was 54 minutes, and that is an average of all the different program queues. And we made some very hard decisions with letter 1 to not list the DHS phone number on that letter, and we partnered with the MCO, our health plans, to help us take those calls because we didn't want the experience for our customers to be poor, so.
Yeah, can you provide clarity on the renewal distribution groups? Who falls under group 1, who falls under group 2, et cetera?
Yes, we actually do have it broken down. Sorry.
Yep.
We do have it broken down, and we can get that information to you so that you can see it formally.
Yeah, you can email that to me.
Absolutely.
And then follow-up question. While I understand that if you fall under 250% of the FPL, which is essentially $34,000 for a single individual, you get some additional assistance from households. Mm-hmm. Let's say you make $37,000. What's the scenario going to be there?
So if you're over income level to be eligible for the 2 months premium coverage and the automatic enrollment, you're still eligible to buy through the exchange. You can come through and connect with federal level assistance, which is those premium tax credits I was talking about, and that's something that can be applied to your premium every month to bring down the cost to you.
And that's an example, though, of where there could potentially be a gap in coverage, correct?
Hopefully not, no, because they will get a notice when they are being terminated from Medicaid that they are eligible for the exchange. And when they get that notice, they can come to Health Source RI, pick a plan, we can help them shop plans and get them enrolled in a plan, and that would ideally be the first day of the month following the month they lost Medicaid. They have a 60-day open special enrollment period, and that coverage can go retroactive to the first of the month after the month they lost coverage. They can also kick off that 60-day special enrollment period at any point in time during the 12 to 14 months that this renewal cycle is occurring.
So we will conclude there. We want to thank you again for having us. Thank you, Mr. Speaker, your honorable membership.
I just wanted to say one thing, which is these wonderful people are always available, not just now, not just today, and I'm sure they might have said that, but if you have questions after Mike Cronin, who's been around this building longer than I have, he knows the ins and outs of getting things done in government, so reach out to Mike, he doesn't do anything with the right person. We want to make sure that our constituents, our members, who talk to our constituents, get the right information. Thank you very, very much.
Thank you.
Thank you. Thank you for having us.
Colleagues, I'll just say at this point in time, the most important thing that we can do in the legislature, specifically if you are on the finance committee, is ensuring that there is more protections for people who get booted off Medicaid. And that includes including more than just 2 months of premium coverage. I would argue we should have 6 months of premium coverage because people deserve health insurance coverage up until the end of the year while also expanding the eligibility. we shouldn't just limit it to 250% FPL. We should ensure that anyone who gets moved off Medicaid is going to have some form of guaranteed health insurance coverage.